Hey, it's Dr. Troy from Zenaptic Chiropractic. A lot of people ask me or come in and say, hey, I have a bulging disc, or they ask me, what's a bulging disc? Do I have a disc bulge? And so I always look to say, what is causing the disc to bulge? So if we look at the structure, the disc is just going to follow the bone. So the disc sits in here. It's this gelatinous substance. It's kind of like jello. And so if the bones are in alignment, the jello is going to be nice and square like an ice cream sandwich. So if your ice cream sandwich, the ice cream is soft and you push down on it, you're going to get the bulge or the disc to squirt out one side. Not completely, that'd be a rupture, but you'll get the disc to bulge. And so people always ask me, well, do I have a bulge disc? Is it painful? And the answer to that is discs don't have pain fiber. So what causes pain? Is it the disc bulge? Now a bulge could push on a nerve root. You can see here there's nerves. A bulge could push on a nerve root and cause neurological issues, yes. But if you're having back pain and you think it's a disc bulge, it's probably not associated with that. It's usually what we'll find is the vertebra. And I always tell patients, I go, okay, if you have a disc bulge, the vertebra in alignment. Now, if the spine goes this way, which way does the disc bulge? It's going to bulge this way. See that? Okay, it's going to bulge to my left. If we go this way, it's going to bulge to the right. And if we go this way, flex forward, it's going to bulge back. Now, true, that could put pressure on the nerves and cause pain, but usually the pain is caused from the misalignment that's irritating the joint capsule. That's where all the pain fibers are. And so how do you correct that? Well, obviously you could take some medication, inject it, but that doesn't fix it. You got to adjust it. You got to use a manual technique to adjust and reestablish function. Now watch. If I take a disc that's bulged to the back and we do this to it, the disc is going to go that way. Who cares? It's not putting pressure on any of the soft tissue and the structures. And then if we can get the joints functioning again, that's the number one cause of back pain, is spinal joint dysfunction. So hopefully that answers your question. Do I have a disc bulge? They did an MRI on over 2,000 non-symptomatic patients, and they found over 71% of them had disc bulges. They had no history of back pain. 71% of them had disc bulges. So what does that tell you? Discs don't cause back pain. They can cause leg pain and other neurological things, but they don't cause back pain. It's usually the joint capsule at the set joint in the spine. So that's stuff we check for. Happy to help. Free consultation. Anybody who wants to get checked to see what's going on with me. So there's a lot of tests you can do to determine what your problem is and the best course of action to do it. This is Dr. Troy. Free consultation if you call 360-260-6903.